I do see some of you brought it today. You should have received an announcement letter and then this frequently asked questions paperwork in the mail. If you didn't, or you would like a replacement copy, see me at the end and I'll have another sent out to you. All right, now we're going to go over the actual plan. Oops. Okay. If you want to follow along and, if you have a question while I'm on that topic, feel free to just raise your hand and let me know. So it is a Medicare supplement plan. So it comes in, there's no deductible for you to pay. So you'll start off just paying, well, you guys have no copays. It's a Medicare supplement plan. So you'll use your Medicare card first, and then you'll present the new card you will receive in the mail as secondary. And you should have no copays for any of your services. So everything $0. You need a hospital specialist, primary care, all of it's a $0 copay. Any durable medical equipment, any radiology services, all $0. Just present those two cards together. You do have chiropractic, acupuncture, and podiatry Medicare covered services. So if you're currently receiving any chiropractic care, Medicare does cover spinal manipulation, so those codes. So if you were to go for the first time, your exam would not be covered, but your codes for the spinal manipulation would be covered. So just to make you aware, that exam would be an out-of-pocket cost, but those other codes would not. And then the worldwide coverage for foreign travel, you do have a $250 deductible that you would need to pay, and then a 20% responsibility for anything that you would need should you travel and need care outside of the country. Some of the highlights for your plan. So as stated, you'll present both your Medicare card and your new United American ID card together whenever you need any medical services. Medicare covered services, any of them are $0 cost to you. If you're receiving a bill, after you present both cards, call RetireeFirst, we'll assist you with that. Your foreign travel, your $250 deductible, and your 20% responsibility for anything medically needed outside of the US. No referrals are needed for Medicare. So as long as you're seeing a provider who is contracted with Medicare, you will need no referrals. You can just go see that provider, okay? And then you have access to the RetireeFirst advocates for any plan questions or Medicare questions that you may have. All right, so for your prescriptions, so there's no deductible for your prescription plan. So you'll just start off paying your copay amounts, all right? The annual pocket maximum amount is a Medicare rule. So this year it's $2,100. So Medicare came in and said, it used to be like $8,500. They came in and said, let's give our Medicare members a break. So any of your copays that you're paying, they all go toward that maximum out-of-pocket amount. So if you're on a higher cost medication, you're gonna reach that faster. And then once you reach it, all copays after that are $0 for the rest of the year. So it's a good thing. I look at it as a good thing. So if you're on any generic medications and you use a local retail pharmacy, you still can continue to use that pharmacy. It'll be up to a $10 copay for a 30-day supply, up to a $30 copay for a 90-day supply. And the new plan does offer a mail order option. If you'd like that, it's convenient for you. It is up to a $20 copay if you use the mail order. So there are some savings there. And then as well with the tier 2 and the tier 3, you would have the $20 and $35 retail for your local pharmacy, and then up to the $60 or $105 for your 90-day supply. And then for your mail order, you see the savings, it's $40 or $70. Tier 4 specialty drugs, they're typically limited to only a 30-day supply at a time. So that's why there are no prices for the 90 days, but it would be up to $35 cost for your specialty medications. All right, some highlights for your prescription plan. So if you're gonna continue to use your local pharmacies, you will not need new prescriptions. You're just gonna present your new card to the pharmacy and they'll run it like normal and your prescriptions will be covered. You can use any retail pharmacy because Express Scripts has over 68,000 pharmacies in its network. If you're not sure if one is covered, give us a call at RetireeFirst. We'll check for you, we'll let you know. or we can just find any local ones in your area and then you can make your decision. And then as well, the mail order pharmacy, it's through Express Scripts. If that's an option that you'd like to, look into, give us a call. You will need new prescriptions for that since it's a new mail order pharmacy altogether, but definitely give us a call and we can help you with that process. All right, after you're enrolled, so you guys have already received your first mailing from the insurance company with your announcement letter, from us with your announcement letter and this FAQ. Once enrolled, you will receive things directly from the insurance company. So you're gonna get your United American welcome kit and your ID card. You're gonna get your United American certificate of coverage. You'll get your Express Scripts approval letter and your Express Scripts welcome kit and your ID card. So you can all expect those. They may come on different days, even if it's a husband and wife in the same house. That's normal, so just letting you know. And these are what your United American cards are gonna look like. There's a front photo and then a back photo. And then here's your Express Scripts card. So they are partnered with Evernorth, but underneath it says Express Scripts. So if you see that, it's okay. But if you get a little nervous, you can call us. It's okay. All right, so Retiree First. So these are some common issues that we address, right? So you call and you say, I received a bill. I'm unsure if these services should be covered. We'll look into that for you. And by that, I mean we're going to tell you right off the bat, yes, you're covered. We're going to ask for the information from the bill you received. We're going to call that billing office, let them know that you should not have received that bill, get the claim rebilled, and we're going to call you and keep you updated throughout the process so that you know it's being worked on. So essentially, we're your legwork. You need help finding a specialist. You need help making an appointment with your doctor. You need to know if a specific drug is covered. So if you're not sure if a medication you're on is going to be on the new formulary, give us a call. We'll look it up for you on the phone, and we're going to let you know what your copay should be. And again, this is some of the things that we can do. We can help with outreach to your providers, medical reimbursements, any billing or benefits questions that you have. We'll make outreach to the pharmacy if needed, if they need your new insurance information. You don't have your card on you, but you're in line at the pharmacy. Any mail order assistance, formulary lookup, any prior authorization if a medication you're on might require it. We can tell you if it does, and then we can also help you with that process. All right, so this is your dedicated web page. I know if you want to write it down from here, but you should have received it in the information that you got in the mail. If you didn't, you can see me after and I'll give you that information. All right, so these are some frequently asked questions that we get a lot of the time when we receive calls. These may be one of your questions that you have, so we'll go through them. Do I still use my Medicare card? Yes, you'll present both your Medicare ID and your United American ID card to all of your providers. Will I be automatically enrolled in the new plan, or do I need to do anything to enroll? You will be automatically enrolled into the new plan, both plans actually, United American and your Express Scripts plan, so there's nothing you need to do to be enrolled. Does this plan have a network? No, you can use any willing Medicare provider for your new Part B supplemental plan. Can I go to my current providers? Yes, you can see any provider that accepts Medicare. Do I need prior authorizations for certain prescription medications? So some prescriptions may require a prior authorization. Give us a call at Retiree First. We'll look that up for you. If it does, we'll get your doctor's information, the medication information. We'll make sure that that's being submitted and pushed through so that you guys can receive your medication. Can I go to the same retail pharmacy? Most likely, yes. So Express Scripts has over 68,000 pharmacies in its network. Again, if you're unsure, give us a call. We'll let you know if they're in network or find you some in your area, if you need help. Who do I call if I need assistance with the plan? You call Retiree First. So you don't need to call the insurance company directly. We are trained advocates on your plan. We can answer any plan questions you may have. And if we're not sure, we will always find out and get back to you with that answer. Okay. So now we're going to open it up for some live questions. Does anyone have any questions about the plan or anything we went over today? Yes.
When will we receive our formulary?
So you don't receive the full formulary because it's like 300 pages. We can probably request one be sent out to you, but it's not something that would be delivered with your kit. So if you're wanting it, just let me know and I'll try to have one sent out to you. Yes.
They can also check all your medications too, so if you have questions about specific medications.
I did call and I talked to a gentleman to ask about a couple of my medications because I'm on specialty medications. And I'm concerned that there's gonna be a lapse in when I'm gonna be able to, I don't wanna lose my medication schedule. So he assured me that there was gonna be like a 1 month.
Grandfather period.
Yes.
Right. So when can I get the process started? If the plan is not gonna be instituted until July 1st, when can I get started getting this pre-authorization done? Because my medications are gonna have to be pre-authorized.
Yeah, I think Sally, I think it's probably July 1st, right?
July 1st,
But
yeah.
The best thing you should do today, though, is leave your name and number with her there and have someone either outreach you July 1st or you call July 1st. That way they can get you inbound or start the process now, like give them the meds that you need so they can start the process as soon as it starts. It's just that the first time the insurance carrier is going to pick it up will be July 1st.
Yeah, so they'll grant you a 30-day fill. Even if you normally receive 90, they're going to grant you that 30-day fill, but they won't give you any more, and that gives us time to get that authorization in place for your next fill so that you can get the normal.
This is IV medication.
Okay.
I have to have, I mean, I get it 3 times a month and I need to have,
Oh, is that at a provider's office?
I beg your pardon?
Is that
Yeah.
at a provider's office?
No, it's at a hospital.
Yes.
Okay.
So that's going to go through your medical.
Yeah.
So you should be good to go there because it's a Medicare provider. So again, make sure you get retired first. But if it's through medical benefit, which it is because it's
Oh.
dispensed at a provider's office, which is
Right.
a hospital.
I'm thinking of the 20% of before, where Medicare would only cover a certain amount and then,
Correct.
Yep, and then the med sup picks up the rest. That's going to carry through as normal. There's not going to be a prior off likely for that. But if there is, you're still going to be able to get your medication. It's just you may have to get
because I got the pre-authorization through Medicare.
Correct, exactly. So
Okay.
that should carry, but again, make sure that they're aware of this and
Okay.
track it for you. The difference between, I think, what you're used to in customer service, and I'm sure you go over this, in RetireeFirst is like, you let them know what the problem is, they will do the research
Oh,
for
he
you.
was, the gentleman I spoke to was very,
Yeah,
because he told me that the medications were covered, but I
Correct.
wasn't even thinking about Medicare.
yeah, I think you're in good shape there from what it sounds like. But
And-
again, make sure they follow for you.
And what about dental?
Is there separate dental offered through the town? Or, yes, and that stays in place?
That stays the same, no change.
No change to the dental.
Okay.
Yes.
Under the current plan, there is an allowance for exercising.
Yep.
Is anything covered under this new plan?
Yep. So, yes, and once you need assistance, just call RetireeFirst and they're going to assist you with that process. Yeah. So it's the same.
It's the same?
Mhm. Yes.
In the paperwork that you sent.
Yep.
For us at home, it said you had to call in your Medicare number, and you just said that we didn't.
So I can check if we have your. Oh, are you familiar?
Yeah, so
Okay.
So we need everyone's Medicare ID number in the room here, so most of you, I think when you called in, they probably collected that from you to RSVP to this. But if you haven't gotten that to RetireeFirst yet, certainly give them a call, give them your Medicare ID number, and that's what carries through. Normally, we would have gotten this all from the previous carrier, but there's challenges with your previous carrier there, so like we have to manually get everyone's Medicare ID number over to
So we
RetireeFirst.
should call and just double check.
Yes. In fact, the general theme of today is, I don't know, is any issues, any questions, any concerns, any problems, anything you ever want to know about your plan, you're
Call
calling.
RetireeFirst.
It's kind of like the Ghostbusters.
Yes.
And another question.
Mhm.
What is the change in the premium that we would have to pay?
There's no change, or
It's like exactly the same, or it's like,
50 cents lower?
I think it's like 50 cents lower, so maybe 25
Yeah,
cents, like
and
it's
that's
half. Yeah.
through the end of the year, because you renew on a calendar year. So we kept your premium the same through the end of the year, and then we'll see what happens in January, because your plan renews in January, not in July like ours does.
So there could be a change in premium going up or?
In January.
Yeah, and we'll see. And the reality is this was not
So
our
we won't have
decision.
that information tonight at the town meeting as to how much, I mean, because it was 50-50 before, how much.
No, we haven't been able to come to, we're negotiating with the unions right now, so we have to negotiate the split with the unions. And until we have that information, it's gonna stay at 50-50.
Yes.
A quick question.
Yep.
You're our go-between.
Mhm.
What do you know about United American Insurance Company? How long have they been in business? Are they equivalent to Blue Cross and Blue Shield? What's their status?
So I don't know how long they've been in business. I know we've been dealing with them for years. And I can tell you that any Medicare supplement plan has to follow Medicare's guidelines. So they're all going to cover the same stuff. Yeah.
Yeah, let me just add to that. That's important for you all to understand. So Blue Cross Blue Shield is your secondary payer, right? So the reality is Medicare covers most of your cost. And then all Blue Cross is doing for you now is meeting the supplement to that. So whatever basically that Medicare doesn't pay for, Blue Cross does. And again, to your point, it's all Medicare guidelines. So in Medicare plans, the carrier, I know it sounds crazy, really doesn't matter, right? It's the customer service that backs it, and that's what RetireeFirst gives you. So, like the reality is, your med sup plan, it's as long as you have Medicare, which you would not be in this room if you didn't have Medicare, you're all set. Like, because again, they just follow Medicare guidelines all the way through. It doesn't matter which the carrier is, to be frank with you. It matters that they pick up the phone, handle your problems efficiently, and that's what we supply for you. The rest is just a function of what Medicare is, which is the most complex system of any health insurance.
Yeah.
They decided that the Medicare folks is a whole different conversation.
Yeah. Yes.
So at what point do you start accumulating your maximum 2,100 deductible? I'm taking it by what Nadine said, if I understood it. We're not gonna start with you guys until January? Or
No.
June, July? Okay.
No.
So when does the deductible start towards your 2,100?
So it's not a deductible, it's a maximum out-of-pocket amount. So
It's a
if you,
deductible.
they're different things, but if you need medications on July 1st and you use your card on July 1st, it starts accumulating.
Okay.
Yeah. So for this year, it'll be July through December, but it'll renew in January.
Right.
So you'll have all year next year.
So what was already accumulated up from January to July this year does not run whether into this program?
Correct, because
So
it's,
we're already in a position that would be maxed out?
Yeah, so on
And
that one,
that's-
I would say collect your Medicare statements on that one and get it to RetireeFirst. Again, normally the previous carrier would have given us that information for you. The trust,
Yeah.
the trust is not in a position apparently to give us that information, so that's the frustration here is we'd be able to do this rather efficiently for you if they did that. So if you have the Medicare, and right now Medicare is tracking that for you right now, so you should have that documentation. So make sure that RetireeFirst gets a hold of that documentation so we can track it for you. The reality is most of you don't hit those phases because your plan's so rich. You have very low copays on your meds, and I think it's no copays on the medical, if that's accurate.
Mhm.
So like it's gonna be very tough for anyone in this room to hit those maximums, but should you be getting close or should you be halfway there, certainly let us know so we could adjust for that. But again, I apologize, I guess, on the trust behalf that they're not giving us that information. It's poor form at best, so we have to work with what we have, and that's the reality of it.
yes.
If the coverage is the same,
Hmm.
what is the logic why the company is changing from Blue Cross?
Yeah, I'll answer that. That was a trust decision. So I think you all know, and I think you've all seen the papers, that the Hampshire County Health Trust is having some challenges financially right now, amongst other things. So Southwick, and I'll let you kind of speak to that, but I'll try and you can tell me if I'm wrong. Southwick sought to make sure they got out of the trust for a lot of different reasons. You know, the health of the trust is not so good. The increases are incredibly high. So they found a better modality for their actives. I think it was all of our goals to keep you in the Medicare plan until January 1st. It was an easy transition for you as well. The trust decided to not allow you to stay in the trust until January 1st, so it forced us to have to get equal or better coverage for you. That's what we did.
Yes.
So I heard conflicting things as to if your medications were covered on the old plan, they're covered on the new plan. So I called your number, and they gave a different answer, in that certain medications have to have prior authorization. And you won't know if you're covered until your doctor fills out the criteria for the new plan. Is that, so you could run up into, you have 1 month grace period, but after that, you could not be covered for what we were covered for prior. Is that accurate?
It's possible, but there are things, like if you've been on this medication for a while, there are things like a formulary exception. Like if it's not on the formulary at all, we can have a formulary exception submitted to have that covered for you since you've been on it a while. But yeah, it is possible. But you've already called. If you want me to look at it before you leave, I can, and let you know what might need to be done. I'm more than happy to do that for you. Okay.
Yeah, and also the reality is the Express Scripts formulary, which is like the list of covered drugs, I think if someone goes in the room, that was the broadest Express Scripts formula that they allow under the Medicare plan. So the reality is we don't see a lot of disruption there, if any, but certainly, you know, stay after, they'll look up your meds to see if it's on that formulary, see if you need a prior auth. But again, they follow Medicare guidelines, so it'll be a surprise if you find any issues there.
Yes.
Quick question,
Yep.
probably directed to the town. You said we're on this for 6 months, January is the new period. Do you plan on staying with United American, or are you looking for options that are more cost beneficial?
This is cost beneficial.
Okay.
If
all
we
right.
could have
Well,
stayed
I
with
don't
the trust.
I don't want to change in 6 months again.
Yeah, and I'll speak to that too. We looked far and wide. Right? I mean, this is not a small process. That United American won the, United American and Express Scripts single-handedly won in each one of their categories. But to say that we looked at every single option from the big boys to the small boys to the local options to the national, like we scoured the market. Like that's what we do for a living, but also because it was tough to beat that rate, right? Because it was a fairly large group, but we were able to do it. So to Nadine's point, like this is the most cost-effective option. I don't foresee it not being the most cost-effective option come January. And from a selfish perspective, to move you twice would be a fairly heavy lift for us as well. So, we're going to do our best to keep you where you are. Good.
So January costs may fluctuate, but the plan will still remain in fiscal July?
You're going back to calendar year. So Medicare always renews January 1st. The only reason we moved you to July 1st is because the trust mandated it. If the trust was reasonable, we wouldn't have had to do it.
Okay, so prescription-wise, this is critical to get the updates from January to July, as far as what's up exhausted.
Yeah, again, I think the reality is it's going to be tough. Like I know the quality of your plan. Like you have very low copays compared to what's like. A lot of those things that we talk about, donut holes, catastrophic phases, a lot of that stuff is really for the personal market because they have high deductibles, high copays, medical copays. The reality is you have no copays on medical and relatively small copays on the pharmacy. So for anyone in this room to hit catastrophic, I would be surprised, but it's possible. And that's why I would say, like, if you have that, track it, get it to RetireeFirst, so we can finish that up for you. But I don't foresee that being a problem here. It's never been a problem in any municipality that I work with. I work with very large cities and very small towns.
So I have a question. You mentioned that Express Scripts has a broad formulary. Is it the same formulary as your company? Or do they do?
So we administer the Express Scripts benefit. That's what. So you don't have insurance with RetireeFirst. Your insurance is with Express Scripts, so it's the same formulary.
So I could look that up.
You could call us.
So I can't look a formulary up online?
You actually.
You probably could.
Yeah, I don't know.
The reality is, you get to RetireeFirst, they'll send you the link at best. You got the right.
Yeah, we want to make sure it's the right. Yeah.
Yeah, like they are your conscience. Like you will find the customer service to be highly augmented to what you're used to. And I think some of you've already seen some of that. Like you're going to be in good hands here. I can give you a bunch of other cities in town that have RetireeFirst. They're all pretty happy. It's like, again, lean on them to do your work for you. I don't think you're used to being able to do that probably, because I know the customer service model you're in right now. I think you'll all learn. The more you use them, the more comfortable you get.
Anyone else? No?
Stephanie?
Yes.
From the back of the room. I think I heard once, and I think it's true, that once you connect with RetireeFirst, they do their best to get you back to the same representative that already knows what you're dealing with. So
Yeah.
that Yeah.
Yes, so if
Can
you
talk
call.
A little bit about that?
Yes, so if you call in and say I'm working, you called me, you got me first, I'm working a billing case for you, you know, you received the bill you shouldn't have received, I'm working that for you. When you call in, if I'm available, it's gonna go straight to me. If not, you can ask for me and whoever answers will see that I am working on this for you and they're gonna get you over to me. If you prefer to work with someone over and over, you can ask for them. I still have people that I deal with and I've been dealing with for a few years and I don't even answer the phone anymore, but I take their calls because, you know, you're comfortable with people. So yeah, you can ask for the same person over and over. So you're not explaining things to 10 different representatives. There's all these notes in the system. So yeah, you can ask for the same person. Anything else? Yes.
Where are you located, physical location?
So we have 2 offices. So I'm from the Mount Laurel, New Jersey office, and then a few years ago we opened an office in Scottsdale, Arizona. Yep.
Okay.
Anyone else? No? All right, we're gonna do the raffle now. So does everybody have a blue ticket? All right, so I'm gonna raffle off first a $100 gift card. Ticket number, it ends in 040. That's you? Yeah?
Kept waiting for the punchline.
No, that's it, really. All right, and now we have a $25 gift card. Ticket ending in 038. Yeah, see, I told you you had a winning ticket. Here you go. See that? Thank you. You're welcome. All right, I will be here after if anyone has any questions that they didn't want to ask in front of the group, or you have just any other questions at all, I'll be here. So feel free to come up and see me. Please take some coffee, pastries home with you. And that's it. Everybody have a great day. Thank you for being here.
Thank you.